Welcome once again to the medical student in this session of the virtual clinical skill training. Our subject today, as you know, is the breath sound, added breath sound, abnormal breath sound. In the previous lecture, we reached this point is a sibilant wheeze. The characteristic of this sound, these sounds are loud, musical and continuous sound occurring throughout respiratory cycle. Expiration period or expiratory period is frequently longer or mainly occurring in expiration. Heard over anterior, posterior, lateral chest walls. Who developed wheezing? In which age group? Which patient developed? Anyone, any age, from infant to elderly adult, can develop wheezing. Children with asthma often develop wheezing. Wheezing is also quite common in infants. It's estimated that up to 25–30% of infants develop wheezing in their first year of life. Wheezing may be more common in babies because of their smaller calibers of their airways. Also, children under 2 years age are susceptible to a common but it's easily treatable condition called bronchiolitis. This is caused by a viral respiratory tract infection and can cause wheezing commonly. In adult, the most common cause is asthma. Smokers and individuals with emphysema and heart failure are more likely to develop wheezing. What are the causes of wheezing? The cause of wheezing vary widely and range from chronic long-term, usually a manageable condition such as asthma, to a very serious condition that include the heart failure. So the most common causes of wheezing or chest wheezing are asthma, which is a chronic respiratory condition that causes spasm, swelling, inflammatory swelling, and the mucus secretion in the bronchial tubes, small bronchial tubes. Bronchitis is inflammation of lining of the bronchial tube. Bronchiolitis most common in young children. Smoking also causes cough and the wheeze. Emphysema is a condition in which the air sac of the lung damage, one part of the chronic obstructive airway disease. Heart failure, called cardiac asthma. Pneumonia and inflammation of the lung tissue by virus or bacteria. Aspirating, breathing a foreign body into the lung. Lung cancer can cause wheezing if they obstructed the bronchioles. A severe acute or sudden allergic reaction called anaphylaxis, caused by food or the stinging by insects or drugs. Most common cause wheezing in adult are asthma and bronchitis. These are two most common causes, are among the most common causes of wheezing in adult. Bronchi are a wheezing, but little bit difference there. Bronchi, we hear it by the diaphragm of the stethoscope, in the chest wall, anterior, posterior, in a sting position, preferable. Characteristic, they are continuous, musical, but high pitch, rattling lung sound, often resemble snoring. They call the snoring bronchi or the snoring wheeze, usually clear after coughing. Mechanism, the snorous wheeze, that's commonly referred as a bronchi, is caused by the same expansion and narrowing of the airway as a sibilant wheeze. The differences between bronchi, snorous sounds, and wheeze sibilant sound is that bronchi is typically associated with the secretion that are obstructing the lung airways. Causes of bronchi, chronic obstructive pulmonary disease also cause wheezing, bronchiectasis, pneumonia, chronic bronchitis, and cystic fibrosis. This is the example of the expiratory wheeze. And this is the example of the sonorous wheeze or the ronchi. Like snoring. Breath sound, other added breath sound important in clinical examination. Stridor. Use a chest piece diaphragm and the position in the chest wall. Maneuver sitting, it might be in a supine, we can't hear it. Characteristics: an audible, harsh, high-pitched musical sound on inspiration. Mechanism: it's produced by turbulent airflow through the partially obstructed upper airways. This partial airway obstruction can be present at a level of the supraglottis, glottis, subglottis, and or trachea. During inspiration, the areas of the airway that are easily collapsible, example supraglottic regions, are suctioned close because of the negative intraluminal pressure generated during inspiration. The same areas are forced open during expiration. So it is the stridor is the inspiratory sound. The mechanism depend on timing with the respiratory cycle. Stridor can be heard on the inspiration, expiration, or both, biphasic, but mainly inspiratory. The inspiratory stridor suggests a laryngeal obstruction, groups, foreign bodies, tumors, infections, whereas expiratory stridor such as tracheobronchial obstruction. Biphasic stridor indicate either subglottis or the glottic anatomy. This is a more details, no need for the undergraduate student, only they know inspiratory stridor suggests a laryngeal obstruction. That's enough. A mechanism and acute onset of marked inspiratory stridor is the hallmark of croup. However, concurrently, there may be a less audible expiratory stridor. Young infants or children who present with stridor, this is a serious sign, required a thorough evaluation to determine the etiology, sometimes a life-saving if the foreign body, and most importantly to exclude the life-threatening causes like inhalation of the foreign body. We will hear example of the stridors. Inspiratory, musical hard sound. Stridor once again. The next sound, or the next added sound, is the pleural rub or friction pleural rub. Chest piece is diaphragm, chest wall is positions, anterior or posterior, in a sitting position, the preferable position. The characteristic of the pleural rub, discontinuous or sometimes continuous, have inspiratory, expiratory. Cracking or the grunting sound, described as similar to the walking on fresh snow on the earth, or a leather on the leather friction types of sound. Sound doesn't alter with the cough, can usually be localized to a particular place on the chest wall, and they also come and go. The mechanism, they are produced because two inflamed surfaces are sliding, I mean plural, parietal and visceral, surface sliding by one another, such as in a pleurisy. Because these sounds occur whenever the patient chest wall move, they appear on inspiration and expiration. Pleural rub stop when the patient holds her or his breathing. If the rubbing sound continues while the patient holds breathing, this is most probably pericardial friction rub. When it is confined to the inspiration, it may be impossible to differentiate and distinguish from inspiratory fine crackles. The mechanism of pleural rub, as we said, pleural rub is usually associated with the pleuritic pain, chest pain. May be heard over areas of inflamed pleura. Common causes of pleural rub, pulmonary infarction and pneumonia. This is the most common cause. Vasculitis can cause by causing the pleurisy. We can hear the pleural rub inspiratory and expiratory. It's not a continuous interrupted. There is other sounds when hear when auscultate the chest, bronchophony, egophony, whispering, picturloquy, and the emphoric breathing. For this stage of your study, it not need to know these sounds. Only to know that the rhonchi, wheeze, crackles, stridor, and the pleural rub as added sound. See you soon. Thank you.